This is difficult because you've got a duty of care to patients, and to this patient in particular as well, but there's also a right for anybody who works in the NHS not to be discriminated against in the workplace. So I think that my response would be informed by local policy. The very first thing to do would be to make sure that the patient is safe, make sure that the patient is stable, either see them myself or get somebody that they might accept if this is something that's life-threatening. I'd also protect other patients by moving them away from this patient, potentially to a side room if possible. And I'd protect my colleague as well by especially if the patient was being rude or abusive towards them, I'll try and de-escalate the situation and take initiative to find out why they're refusing. Did this particular doctor say something? Is the patient under the influence of drugs or alcohol? Could this be something like medical delirium, or is the patient just being discriminatory? And again, that would affect how I approach this scenario. I then take my initiative to explain to the patient that there's a zero tolerance policy in the NHS for racism or discrimination of any kind. Again, depending on hospital policy, hopefully I'd know my local policy. Some hospitals refuse all treatment. They might even blacklist the patient from ever receiving care at the hospital. Other hospitals are more lenient and allow emergency care to be provided. Again, this is something that I would hopefully know depending on what hospital I work at. The next step would be to escalate my seniors for advice. I'd want to escalate as early as possible. The seniors might themselves decide whether to escalate to the police if there was harassment or violence involved. I'd also want to support the colleague who was discriminated against, as well as other staff or any patients who might have been affected by what they've seen. And I'd want to document clearly everything that's happened in the notes. I might even consider filling in a datex if there were any adverse effects, either to the staff or if this was an episode of discrimination. It's important to make sure that there's a written record so that we can reflect and assess the steps that took place and learn from the experience as well. I think patients can, in some circumstances, choose their doctor if there is a valid reason. So for example, a female wanting to see a female gynecologist is something that is most likely acceptable. I don't think it would be acceptable. I don't think patients do get to choose their doctor if it's based on discrimination, based on race, ethnicity, or other protected characteristics. I think that would be setting a very bad precedent, and I think that fortunately it isn't possible for patients to do that. Again, I would start from the beginning. I think the most important thing to do would be to try and de-escalate the situation, try and engage the patient in a non-confrontational, sort of non-judgmental manner, try and find out what's going on. My priority would be patient safety, both for this patient and others around the patient as well. So if I could move the patient, call security, try and get the patient protected, get everybody else protected as well, that would be my priority. I'd try and find out information, find out why the patient's getting agitated. Is this something that I can address? Is it because they've been waiting for a long time? So actually maybe just seeing someone might help de-escalate the situation. Or is it something that needs to be escalated to seniors and security straight away, especially if the patient's under the effect of alcohol or drugs? They might not have capacity to make any decisions at the time. Early escalation would be extremely necessary. Finally, I want to support my colleagues. I want to support any other patients who would have seen the incident, been affected by the incident, and support the patient as well, especially if they were in a vulnerable situation. Finally, I want to document all of my steps clearly. And if there was violence or any discrimination involved, I'd want to fill out a datex form so that everybody can learn from the experience in the future.